it's Dr. Lakia Wright. I'm just going to give it a few seconds here. Okay, I see some people joining now. Sorry about the technical difficulties. I was running a little late, overcoming some of the technical challenges. Again, it's Dr. Lakia Wright here, and I am a board certified allergist and immunologist. I'm also medical director of U.S. Clinical Affairs at Thermo Fisher Scientific. I know that is a mouthful, very long title. Welcome to Right Now Allergy Updates with Dr. Wright. And then, in this video, what we're going to do is we're going to talk about food allergies. It's really part one of a series. And in this time, I want to talk about early food introduction and signs and symptoms of food allergy in infants. And and we'll go over some of the nutritional sort of aspects of there and why early introduction is encouraged in infants. And that's going to be to also, celebrate Nutrition Month that's coming to a close now. So, let's dive in. But don't hesitate to leave questions in the chat bar, and I'll get to them a little bit later. So early food introduction, it can be a little scary or intimidating. Even me as an allergist and as a mom, it was very scary to introduce those, top 8 allergens in my daughter's diet. So I think that's why, it's something really important. It's a really important topic to talk about. And this video is really meant to be educational so that you have, some pointers to talk to your doctor, about. And when we talk about those potentially allergenic foods that we're introducing, we're talking about those top 8 or now top 9, allergens like the milk, the egg, the wheat, the soy, the peanut, tree nuts, fish and shellfish. And then, of course, sesame as well. Or sometimes you'll see it as like tahini, in things like hummus. And so what I really wanted to do is go over the ABCs of early food introduction and then go over those signs and symptoms that you want to look out for when you're introducing foods in infants. So, go over the who, what, when, where, why, and how. So again, we're talking about, infants here. And then the what, with the early food introduction, I mentioned those foods that, those top allergenic foods. And it's really that babies have to learn how to eat. So it's really that you want to, start off with the not common allergenic foods. You really want to start off with some, vegetables and fruits. And typically, even before that, you would go for the, like the rice cereal. And so that the baby learns how to eat. And then from there, you can go over to introducing, the potentially allergenic, foods or the most, common food allergens. And when you're doing that, what are some of the signs and symptoms that the infant can exhibit? And so because infants are not going to say, right, like, I'm itchy, they're babies, or they're not going to say I'm short of breath, but they can give you signs, that, they're reacting to the food. So the signs, when we're talking about signs, we're talking about, let's think about the skin. So hives, hives are red, raised, and itchy. But when you're introducing foods, to infants, they can get sort of like a little redness, and that can be from the contact, and foods in general can act as a irritant. But then if you see like hives developing in areas in which the food didn't touch them, although they tend to, get messy when they're eating, that can be a sign, but that would be red and raised. Sometimes you will see infants sort of scratching at the skin, which can be a sign. You do want to remove their clothing so that you can do a complete, skin exam to see sort of what's going on, and even looking in their diaper area. And then also vomiting, right? So babies tend to spit up, but are they vomiting? Is it something a little different than they would normally do? And then diarrhea, right? Infants can have some loose stools. They're still learning how to digest their food. Their digestive tract is developing. But are they having diarrhea? Those really watery stools. And fussiness. They can get very fussy and irritable, and sometimes just refusing to eat. And that itself may not be a sign, but you can look out for the combination of signs or symptoms. And then sometimes you can see flushing or the baby turning red, as well as coughing, wheezing, and sort of the baby just looking really uncomfortable. And then sometimes they'll do some sort of abnormal belly breathing, and that could also be a sign. So, when should you start introducing those foods? And that's really a conversation to have with your doctor, your pediatrician. We have the best data for peanut and high risk infants. And when I say high risk, I'm really referring to infants that have, eczema and typically moderate to severe eczema. Eczema is such that they require, topical medications or medications for their eczema. And for peanut, those high risk individuals, the recommendations are really in that the 4 to 6 month range. That can be helpful to try to prevent food allergy, because again, these recommendations are to help to try to prevent food allergies. And the earlier introduction study, which was the LEAP study, learning earlier about peanut allergy, looking at that data, the 4 to 6 month range was a good time to try to prevent the food allergies. Now, there is always sort of this push and pull, because, breastfeeding for women who are able to breastfeed, exclusively breastfeeding in the first 6 months of life also has its benefits. And so, for some women, they might choose to delay until, 6 months, but it's definitely a conversation, to have with your doctor. And then I often get asked the question, well, what about the other, allergenic foods that you mentioned, those, top 8 common allergens, common food allergens, or top 9. And we have the most data for peanut, and we have some strong data for egg as well. And perhaps introducing it like in that 6 to 9 month range. But we can, extrapolate some of that data and say earlier is better than later, after the age of 1, because we see that, waiting to introduce the foods, is associated with likely a higher, risk of developing the food allergy. Or developing food allergies. So it's really a conversation to have with your pediatrician. And so, so when do you do it, or where do you do it? You want to do it at home, right? And you want to have sort of control over the environment, and make sure the baby's not sleepy or it's not around nap time, because that can also influence the baby's, mood. You can introduce, one new food at a time, right? But then keep the foods that you have introduced in the baby's diet on a regular basis. And then when you're introducing the foods, you want to wait like 2 days in between, just because if you're introducing multiple foods all at once over a short period of time, then it's hard to tell, what it could be the potential culprit allergen. And, how do you introduce it, right? Well, because you want to definitely introduce it in an age appropriate way. Like, for example, of course, nuts can pose a choking hazard for children. So you want to make sure that you have good recipes, and make sure that the child is able to swallow and take in the food in a safe way. And I have found that, the FAIR Network, they have excellent resources for parents about early introduction of, potentially allergenic foods, solid foods. And then they have the babyfirst.org website, which has some good recipes on it so that you can have a little bit more guidance on how to introduce. So then I want to turn over to my Mythbusters section. These are just sort of comments that I get commonly that, I want to just address because it comes up so commonly. So the first one is, I should wait a couple years before introducing those top 8 allergens. And that's false, right? Because we, according to the American Academy of Pediatrics and studies, that the early introduction is better. So false. And then, the other thing, number 2, is, if I introduce peanut early, then I'm going to give my child a peanut allergy. That's false. So we're giving, the recommendation is to give peanut early to try to prevent the peanut, allergy, but not that you're giving the child, an allergy by introducing it early. So this is in direct contrast to what we used to say years ago, delay those allergenic foods. Now we know that based on the research, that earlier introduction is better. So it's definitely something that you have to talk to your pediatrician about. And in high risk kids, those kids with eczema, since they're high risk, you definitely want to talk to your pediatrician, and sometimes it may be appropriate to see an allergist as well, or get a referral for allergy. And so what I wanted to do now is move on to questions from the audience here. I see we have one question. Do you have any tips on how to introduce peanut to your infant? Yeah, so that's an excellent question, a question that I get often. There are recipes on that babyfirst.org. And it really just depends on, how old the infant is. For example, if they're, around that 6-month age and they've had yogurt before, I've found that, mixing the peanut butter with their favorite baby food, like a yogurt or some other sort of blended food that they really like, that can help with them, getting adjusted to eating peanut for the first time. I will tell you that my daughter was not a fan of, peanut butter. And so it took some getting used to. And then there are other recipes where you can thin out the peanut butter and make it thin so that you can put an appropriate amount inside of, a bottle. And so I would refer again to the American Academy of Pediatrics, the Quad AI. They do have some of those recipes posted online. But good question. You want to make sure that you're introducing it in an age-appropriate way and not presenting a choking hazard for the child. But mixing it with a favorite food is good. And then we have another question here. Can cross-reactivity in foods happen in babies, or are those allergies developed? And so that's a good question as well. So there are things, cross-reactivity among foods. So typically what would happen is, a child or infant would exhibit signs or symptoms of that food allergen, and then as the allergist, I would then have to ask about, are they tolerating foods that could potentially be cross-reactive? And cross-reactivity comes from, sort of foods being similar, but not exactly the same in structure. So sometimes you can tolerate some foods that may be cross-reactive, and then other times they're so similarly structured, they're so similar in structure that it can't be tolerated. So that's a good question that needs a little bit more digging with the help of your primary care provider, pediatrician, or perhaps even your allergist. And then let's see, any other questions out there? I know another question that I often get asked is, well, what about my child ate a strawberry and then they developed some redness around their mouth? Are they allergic to strawberries? Strawberry allergies are uncommon. So sometimes what can happen is that sort of like the juice from the strawberry can be an irritant. So again, watch out for those, signs and symptoms that I mentioned before. But again, strawberry allergy in itself would be, rare. But the juices from foods or the liquid inside of some, fruits or vegetables can serve as an irritant. And then I have a question here. I'm allergic to peanuts and was told to wait for my son to turn 5 to introduce him to peanuts. First time he tried it, it became his favorite. He now eats peanut butter and jelly sandwiches. Yeah, so that was sort of older advice. And now we know that delaying may be contributing to the rise that we see in food allergies in part. So we know that early introduction is actually better. Particularly, we have the data for the for those high-risk individuals with eczema. So we as healthcare providers are trying to get that message out there, and that's why I'm so happy to talk to you guys today about it, because early introduction of allergenic foods is what is recommended now. We have the most data for peanut, and some data for egg, and we are trying to help prevent food allergies. And then the thought is that if you introduce it earlier, then your body could get used to seeing it, as opposed to waiting later where you might have a lot of antibodies are already built up, and then this food that should be perceived as harmless by the body is seen as sort of like an enemy, and the body goes on attack. So while the immune system is young and still developing, there may be a better chance at trying to prevent that food allergy from developing. And so I see those were all the questions we had for now, but I will go over 3 tips before I close out. And so I think that it's really important for parents and families to come up with early food introduction sort of plan. You have to plan for these things. And when you plan for these things, then it just goes much better. And it's something that you can talk to your I call it baby meal planning. And you have to put that early introduction of allergenic foods into that baby meal planning. And then once you have that sort of, in your mind about, when you would like to introduce the foods, you have to specifically talk to your pediatrician about that. And then once your pediatrician gives the go ahead, because, when infants are ready to have solids, it's really, we're looking for some signs like, they have to be able to hold their head up. They have to be able to propel their and thrust their tongue so that they can eat in a safe way. So that's why you really want to talk to your pediatrician. So the first question is, is the baby ready to sort of handle the introduction of solids? And then number 2, well, what order am I going to go in? Because again, you want the baby to have a really well-balanced diet. And you don't want to just start off with those, commonly allergenic foods or potentially allergenic foods. You want to start off with, more fruits and vegetables and the grain cereals, and then work your way into those, top 8 or top 9 common allergens. And then You want to specifically discuss that plan with your doctor. And then once you get the go ahead from your doctor, you feel confident, you've had the discussion with the pediatrician, you want to keep a food, you want to keep a food diary documenting sort of anything that is worrisome, and being able to talk to your doctor. And of course, if there's any really concerning symptoms, difficulty breathing, wheezing, things like that, swelling, of the lips or eyes or anything like that, you want to call 911. And then also, if there are sort of milder symptoms, you're not quite sure, you want to take a picture of it and also talk to your pediatrician. And so I think, coming up with a plan, discussing it with your pediatrician, and then number 3, keeping that food log will put you on the right path to the early introduction. And so I do see. Oh, okay. I thought there was one more question coming in, but I see there aren't any more questions. I am so happy that we were able to discuss this important topic today. And I'll see you next week. And again, we'll continue the conversation about food allergies. Please share and like this video if you like it. And for more information, please visit the link in the video description, and you can find more educational resources on allergyinsider.com. But until next time, take care. Bye-bye.